Good morning, everyone. Welcome to today's webinar on our sinus relief facial. Um, it's a wonderful time of year, actually, to be talking about this because we're dealing with the prime season for allergies right now, and a lot of people suffering from congestion and sinusitis and issues with the sinuses. And if it's not us, we know certainly of a client or a friend or a family or someone that does suffer from these conditions, and there is a nice alternative way to treat this rather than always taking the over-the-counter medication. So it's a nice alternative to be able to offer to our clientele where they can get relief from their symptoms without having to worry about side effects that some of these medications have to offer. So what we'll go through today is we'll talk about the differences between, we'll talk about the definitions of sinuses and sinusitis. We'll talk about the different causes and triggers and risk factors. We'll talk about the symptoms of sinusitis, chronic sinusitis, allergic rhinitis, things like that. We'll go through the different sinus cavities. There are 4 of them. We'll talk about the names, where they're located. We'll also talk about the effects that having chronic sinus issues can have on the skin, as well as different treatments. We'll get into different traditional treatments, complementary treatments, things that we can do in the spa, as well as more of the folk remedies that we can do at home. And then we'll get into the cures, products, and ingredients that we would use during the professional Cure Sinus Relief Facial. So let's start first with the definition of sinuses. Sinuses are basically a system of hollow air-filled cavities in the skull. They're located between the eyes, behind the cheekbones, and in the forehead. They're connected to the nasal airway by a narrow hole in the bone called the ostium. There is mucus in here that keeps the inside of the nose moist, which helps to protect against dust and allergens and pollutants. That mucus drains through a narrow duct into the nasal cavities. Normally, all the sinuses are open to the nasal airway through the ostium when it's healthy. Okay, we're going to get into what happens when it's not healthy. So the definition of sinusitis is when the super thin mucous membranes that line the sinuses become inflamed, infected, and swell. The inflammation can be caused from colds, hay fever, allergies, or some type of chemical or particle irritation. The infection comes in when there's a pathogenic microorganism, whether it's a virus, it's a bacteria, or it's a fungus that grows within the sinuses, which causes an intermittent blockage of the sinus ostium. Sinus infections, we know, can be very painful. They can be long-lived. They can be difficult to clear up, even when we're on antibiotics. So it really is important that we take a very multidimensional approach to this condition. I hear it so many times when people talk about sinus infections that it lasts for a month, it lasts for 2 months, and you know that there's really no other infections as far as, even things like the flu that are going to really linger for that long. When the congestion builds up with infection, it blocks the channel, so the mucus can't drain into the nasal cavity. This provides a perfect breeding ground for bacteria and for viruses. It causes painful, tender eyes, cheeks, nasal passages, headaches, earaches, anything like that can be caused from these infections and blockages. And sinusitis can be classified as either acute sinusitis, subacute sinusitis, chronic sinusitis, infected sinusitis, and non-infectious sinusitis. So some sinus facts. We have our sinuses for a couple of different reasons. Number one, it keeps the head from being too heavy. If our skull was complete solid bone, it would just be too heavy for our neck to hold up. So it allows for the head to not be so heavy. The sinuses are also responsible for the depth and the tone of our voice. We know that when we wake up or when we have a cold or something like that, it does change the sound of our voice as compared to when we're healthy and awake. The sinuses are also responsible for humidifying and warming any air that we breathe in before it reaches the lungs. The sinuses also filter the air that we breathe in. So when we breathe in the air, the sinuses help to remove any dust, smoke, pollen, pollutants, anything like that before it has a chance to reach our lungs. The sinuses also help to insulate the surrounding structures, our eyes and our nerves. They buffer against any type of physical trauma, and they are considered part of the respiratory system. We have 8 sinus cavities in total, so it's 4 pairs. The first one and the largest one is the maxillary sinuses, which are located under the eyes in the cheekbone, and you can see in these pictures exactly where they are. We also have the frontal sinuses, which are in the lower center of the forehead, just above the eye area. We have the ethmoid, which is between the nose and the eyes, behind the nasal bridge. So it kind of when you squeeze the bridge of your nose, they're right behind there. And then we have the sphenoid sinuses, which are behind the ethmoid. And you can see when you look at the side view of this head, really where those sphenoid sinuses are located, and really kind of now how close we're getting to the brain. They are behind the nasal cavity. They're at the center of the skull base, under the pituitary gland, and behind the eyes. The largest sinus cavities, which are those maxillary, are about 1 inch across, just so you have an idea of how big these are. Sinuses are lined with a soft pink tissue called mucosa. Normally the sinuses are open except for this thin layer of mucus. And then we have turbinates that are also in the sinuses. And you can see in this picture it's kind of like the ridges. These they're ridges on the inside of the nose. We have the septum, which is the thin wall that divides the nose into the right and the left. We have the middle meatus, which the sinuses drain into the nose through this small drainage pathway. There is no blood flow to the middle of the sinuses, and the most commonly infected sinuses are the maxillary and the ethmoid. Statistics in the United States, there's about 37 million Americans that are affected every year. So, you know, normally when I'm in a classroom setting, I'll go around the room and I'll start my class by asking everybody, how many of you have ever been affected by a sinus infection? Keep your hands up. How many of you have ever been infected by seasonal allergies? Keep your hands up. How many of you have a friend or a family that's ever suffered from any of these conditions? Keep your hands up. By the end of just a couple simple questions like that, you have every single hand up in the room. And it really just goes to show you that there are so many people that are affected by this all the time. There's a lot of people that we can be reaching and treating with some of these alternative treatments. About 15 to 20% of the population has chronic sinusitis, which means that it lasts longer than 3 weeks. When you have something that lingers for that long, we know that it can start to affect our work productivity or our school performance. It can make you very tired, very lethargic. So it has a real big impact on our life when we're not feeling well for that long. 32 million cases are chronic sinusitis. 29.3 million adults are diagnosed with sinusitis, and 12.5 million visits to the physician's offices, hospitals, outpatient departments, and emergency departments with a primary diagnosis of sinusitis. This is one of the most expensive disorders in the United States when we talk about prescription, non-prescription medications, and all of these doctor visits, because it is something that just lingers for so long, and so many people suffer it for so many different reasons. So the causes of any type of sinus condition are, number one, inflammation. All right? When the tissue in the nose is swollen, it can block the sinus passages, which means that the sinuses can't drain properly. When they can't drain properly, it leads to pain, and it puts you at higher risk for sinus infection. This may be caused by anything that interferes with the airflow in the sinuses. It can be from allergies, a cold, environmental triggers. It could be from things like cocaine, from cigarette smoke, anything like that that causes that inflammation in the sinuses. It can also be caused from an infection, so some type of pathogenic microorganism that grows within the sinuses. Most sinus infections are not contagious. And a lot of times it can happen when there's a lowered immunity. So we know the immune system helps to fight bacteria. When it's lowered, if we're feeling, maybe we just had a cold or something like that, these bacteria typically grow a lot easier when our immune system is lowered. It can also be caused by a sinus blockage. And this is almost more like a physical blockage where we could start to see tumors or growths or things like that inside of the sinuses. The ostium is that transition space. It's the narrow space in each sinus. It's responsible for the drainage. If that space is bottlenecked or blocked, the mucus backs up behind the blockage. Again, this is a great breeding ground for bacteria. About 10% of the population has an extra sinus. So we know that if we have an extra sinus, it's probably going to take up additional room, which means that the sinuses that we do have and the openings that are there are going to be narrower than what they should be. So if there's impaired drainage, whether it's from a thickening of mucus, people that suffer from cystic fibrosis, things like that, have that very thick mucus. It could also be from a decrease in hydration brought on by disease. It could be from very drying medications. If we're overusing things like antihistamines, that can cause that area to become very dry. If there's lack of humidity in the air, that could be drying everything out as well. If there's any type of cilia damage, we know cilia are basically those little hairs that help to push things through. If that's damaged, and typically that becomes damaged from things like chemical irritants, cigarette smoke can damage that, then we're not going to have the proper drainage. Deviated septum can also cause a lot of sinus problems. Okay. I mentioned earlier that the septum is that wall that separates the nasal passages into the right and the left. 80% of people have a nasal septum that's been displaced to one side. It can be displaced either just because that's how we're born or because of some type of trauma. Maybe we broke our nose, we got punched in the nose, a ball hit us in our face, anything like that could cause it. Obviously also things like overuse of certain drugs, things like that can also cause problems with the septum as well. This leads to chronic sinus issues and obstructed breathing and snoring when it's offset. And you can see in this picture to the right, the one that's a little bit more close up, ideally the septum should divide the nose into two equal sides. But when the septum is deviated, we can see that one side is bigger than the other side. And obviously the smaller side, we're going to have a harder time with proper drainage. If we have narrow sinuses, and this is very common, this is just pure genetics, but it is very common. And in narrow sinuses, you'll see that there is a longer, narrower path for those transition spaces to drain. So again, it's going to make it harder for the proper drainage to take place. If this is the case, then mucus can kind of sit in there and kind of pool up and again become infected. When we start talking about fungal infections and how this affects the sinuses, this is something that you're not going to see all that often, but if you do see it, it's something that needs medical attention immediately. And fungal infections you'll typically see in victims of trauma or natural disasters where they're breathing in the fungus from the soil. Typically you'll see this when there's big earthquakes or tsunamis or I always think of like, 9/11, things like that, where there's just a lot of things shaken up, a lot of fungus being disturbed, and we're breathing all of that in. Well, the fungi can grow and cut off the blood supply to the tissue, especially in the nose and eyes. It is very rare but serious, and sometimes it can also be deadly. There are no fungal vaccines to prevent a fungal sinus infection. So if we do see this, it does require immediate medical attention and possibly some type of surgical care. If the cause of our sinus problems are due to sinus sensitivities and allergies, it could be from any number of things in the environment. Pollen, certainly. These are things that we inhale through our mouth or through our nose and can irritate the sinuses, leading to that inflammation that we talked about earlier. Most sinus allergies occur in the spring or late summer or even early fall, and this is because the air is very dry. It's a great time for those airborne particles like pollen and ragweed to kind of just be floating in the air. Usually they will end by the start of the winter because of the frost. Dust and dirt is another big one. If you have any type of sensitivity to dust and dirt, it's certainly recommended that you remove any type of rugs or stuffed animals from your house because they hold a lot of that dust in there. And you want to make sure that you're really keeping the dust to a minimum. So especially areas where you're in your house a lot and there's a lot of dust accumulating, bedrooms, living rooms, things like that, you really want to make sure that you do a nice damp dusting at least 2 times a week to keep that dust at bay. Pollution is another big one. You know, even inside of our house, we want to make sure that we're changing and cleaning the air filters in our heating systems and air conditioning systems regularly. The ozone, carbon monoxide certainly has a lot to do with this as well. You know, if that's the case, you know, keep green plants around in your office, in your spa room, in your home. You know, things with a lot of foliage can help to absorb any of these toxic chemicals, you know, things like formaldehyde and things like that. Animal hair, this is another big one where people tend to be allergic to the dander or basically the flakes of dead skin on animals. Mold is a huge one where it thrives in warm, moist conditions. So we know that spores really tend to grow after like summer rains and things like that where it's moist and where it's warm. So a lot of times you're not seeing these mold conditions in real dry regions, but really where it's more, has more of a warm, moist humidity in the air. Dead insects remains and waste. I know this is kind of like a gross one to talk about, but it really is something that you need to be aware of because dust mites are those little tiny bugs that live in our pillows, our mattresses, our favorite couch, our favorite chair, anywhere where we tend to lay around a lot because they feed on our dead skin. And then we'll carry them from our mattress to our couch. We kind of carry them around. Or they'll jump onto our clothing, things like that. What's interesting is that, and I know I'm going to get the numbers wrong, but it's something like over 20 years, our mattress weighs an extra 10 pounds because of all of the extra dead dust mites and their remains that are in the mattress. So it just goes to show you how much can accumulate over time. And how important it is to really make sure that we're keeping these areas clean, cleaning them on a constant basis, or putting any of those protective covers around mattresses and pillows, things like that. We can also have food allergies or food sensitivities, and we're seeing more and more of this. Things like dairy products, eggs, shellfish, nuts, red wines, fruits, anything like that can cause the nose to swell and can lead to a sinus infection. Allergies are basically an exaggerated reaction by the body in order to defend against dangerous foreign substances. There's a release of histamine triggers, which trigger a dilation of blood vessels in the nose and prevent the sinus cavities from clearing the bacteria. Flying can also be a cause, and we know that a lot of times when the plane takes off, we're feeling a lot of pressure. The pressure is reduced, which means the pressure builds in our head. It blocks the sinuses or the eustachian tubes in the ears. And this also happens again when the plane descends, when the pressure changes again. So avoid the pain, especially if you know that you haven't been feeling good or if you have sinus issues. You might want to take a decongestion or a nasal spray or ask your doctor for some type of prescription inhaler that you can use before the flight. So there's a couple different categories of sinus conditions. We can have an acute sinusitis, which is your basic sinus infection that typically lasts less than 30 days. Subacute sinusitis is typically something that lasts over a month, but less than 3 months. Typically, subacute or chronic forms are usually the result of some type of incomplete treatment. So if the doctor put us on some type of medication and we didn't finish it, that's when you'll kind of start to see it linger. Chronic sinusitis is greater than 3 months. Chronic sinusitis can be caused from, those more genetic issues or physical issues where things like deviated septum, things like that are not allowing our sinuses to drain the way that they're supposed to, and this causes that constant inflammation in the sinuses. You can also have allergic rhinitis, which is where the allergens like pollen and dust mites and pet dander cause the defenses in the nose and sinuses to overreact. This is non-infectious, but typically you'll have some type of mucus or nasal congestion or sneezing or itching, things like that. You can also have turbinate hypertrophy, which are basically those ridges that we talked about earlier that are on the nasal septum. They've become enlarged and, again, obstruct the airflow. Nasal polyps is another big one. And a lot of people can develop polyps in their sinuses or in their nasal cavities. Basically, they're small growths that grow in the nasal cavity in response to inflammation, asthma, chronic sinus infections, and allergic rhinitis. And you can see in this picture, obviously, it's going to block the proper drainage. And we might have to have some type of surgery to remove these. There's also something called sinus-sinus rosacea, which occurs when rosacea causes the sinuses to become inflamed. So that's something that you need to be aware of as well. Now, if you're someone that does suffer from sinus problems, there are a couple of different tests that you can have done. You can have a basic physical exam where the doctor basically looks through your nostrils with a lighted viewer to see if there's any type of swollen turbinates. They might tap or press on your face over your sinuses to check if there's any type of pain or tenderness. You might also go for a CT scan, which basically uses x-rays and a computer to give you a real detailed image of the sinuses, and basically just helps you to get a proper diagnosis. An MRI uses magnetic waves, and again, it creates a real detailed image of the sinuses, and a lot of times doctors will use a CT scan and an MRI together to really get a complete image and to really be able to come up with a very solid diagnosis. You also might see something like endoscopy being done where there's a flexible tube with a camera on the end that's inserted into the nose and the sinuses so that the doctor can really see what's going on in there. Sinus cultures might be taken where there's a mucus sample taken from the inside of the sinuses, and a lot of times this is done with a needle during the endoscopy. A skin test might also be done, and this is really going to test for different allergens to see what your possible sensitivities are that could be contributing to your sinusitis. And x-rays can be used also. X-rays are really going to show problems with the bones around the sinuses. So again, you might have a combination of different tests done, maybe a CT scan with x-rays. Maybe if x-rays don't show enough, then you'll go to the CT scan where it can show you a little bit more information than an x-ray can. So typical symptoms that we'll see with any type of sinus condition. We'll see redness and swelling of the nasal passages. We'll see nasal congestion. We'll see tenderness when we're tapping over the cheeks or the forehead area. And typically wherever you're having tenderness is where is relevant to the sinus that's being infected. So you'll see if people kind of are tender or if they're kind of like squeezing or pressing on their forehead, chances are it's the frontal sinuses that are being affected. You know, if it's more in the cheek region, the upper teeth region, it's probably the maxillary sinuses that are being infected. Headaches can certainly occur as well. A lot of times it happens in the morning when you're waking up. You might have a fever, but not always. It's really only about 25% of the population that suffers from sinuses or sinus issues that really ever come down with a fever. Swollen cheeks are also very common because there's a lot of fluid that's being retained, and so you'll get some swelling that's happening. Nasal congestion, sore throat, a cough, a lot of times because there's some type of drip that's happening. You'll see an increased sensitivity or headache when you're leaning forward because there's additional pressure on the sinuses. Tooth or ear pain is very common also at this point because If you're having an issue with the maxillary sinuses because they're so close to the upper jaw and the teeth, it causes your teeth to ache. And a lot of times people with maxillary infections will go to the dentist thinking that it's a problem with their teeth, but really it's a problem with that maxillary sinus. Fatigue. Bad breath because of this constant drip that people are having, loss of smell certainly if we can't smell if we're congested, and the pain can be very disabling and require hospitalization as well. I mean, it really can get that bad. Certainly we'll see swollen eyes and eye bags because of this. We know that the eyes have the highest concentration of water content on any part of the face, and we know that the skin is thinnest here. There's no oil glands, and the eyes are a very responsive area to the changes in the body's water content. When you start to look at the Chinese philosophies of face mapping, skin mapping, body mapping, all of that, they believe that the kidneys have a direct correlation to the appearance of the eyes because they view the kidneys as a storehouse of qi, or the life force, and they believe that the kidneys distribute that qi to the rest of the body. So they will reveal a wealth of genetic lineage. They also, the kidneys we know are also responsible for purifying the blood by removing waste. So if that's not happening, you will see the swelling around the eye area. If someone feels weak or chronically tired, you should rest and treat the kidneys. And basically there's 3 different ways that the Chinese believe that you can truly harm the kidneys. One of them is living against the rhythm of nature. So if we're working at night and sleeping during the day, if we're traveling a lot, we're just not getting the right amount of sleep, that can certainly affect the eyes. And we know as soon as we're tired, we see that in the eyes. If we're draining ourselves of energy, if we're working too hard, especially at jobs that we don't enjoy, things like that, we could be robbing ourselves of energy, and you'll see that in the eye area. If there's a poor diet, especially if you're eating foods out of season or highly refined foods or foods with a lot of chemical additives, you'll again see this in the eye area. So this all goes back to kind of the Chinese philosophies when we're looking about how things are related, and in particular in this situation with the eyes. In allergic rhinitis, the symptoms that you'll see: itchy, watery eyes, itchy, runny nose, excessive coughing and sneezing, post-nasal drip, sore throat, bad breath, loss of taste and smell, nasal drainage, usually is clear or whitish when it's just allergic rhinitis. All right, complications are something that are an issue that we really need to be aware of, because if you think about where these sinuses are located, especially that sphenoid sinus, and we think about how closely they are to our eyes, to our brains, things like that, it really becomes very obvious why we need to take care of this condition as quickly as we can and really get it fully cleared up. In rare cases, we can see these complications, but again, things that we need to be aware of. Meningitis can happen. This is where there's an acute inflammation of the meninges. Basically, that's the membrane that covers and protects the brain and spinal cord. We can see brain abscesses, again, characterized by inflammation due to an accumulation of pus in those local tissues. We can see vision loss. Again, think about how close all of these sinuses are to our eyes. Osteomyelitis is basically the infection of the bone or the bone marrow. Orbital cellulitis, which is the picture that you're seeing on the left side with the swollen eye. Very serious infection of the orbital tissues. You'll get restricted eye movement, swelling and redness of the eyelids. I mean, certainly we don't want to see this in anybody, but again, something that you need to be aware of. Let's talk about how sinuses and sinusitis can affect our skin. We can get irritated, dry eyes, facial swelling, usually around the eyes and the cheeks is where you'll see that swelling, dark circles around the eyes. The skin is very tender to the touch. We can get raw, tender skin under the nose. We can start to get pustules, right? Again, because there's a lot of inflammation and congestion under the skin. And we know that when there's things happening under the skin, in those areas we can start to see pustules forming on the outer layer of the skin. We can also see things like hives, things of that nature. So a lot of different things can be happening depending on what the cause of the sinus problem is, but we can see a lot of different things happening on the skin because of this. So when it comes down to how do we now treat these signs and symptoms, it's important to understand that it's much easier to treat these symptoms in the earlier stages, especially before the bacterial infection actually sets in. If we catch it at that point, it usually does respond very well to self-treatment. Begin with adequate treatment of hay fever and colds. You need to see the doctor when sinus pain does not improve after taking your over-the-counter meds for 3 to 5 days, when there's a fever, a cough, or a headache longer than 1 day, if you develop swollen eyelids or swelling along the sides of the nose, if there is a greenish yellow discharge, blurred double vision, pain or paralysis in the eyes, if the eyes turn red or bulge, and if there's any type of nausea or vomiting. It's recommended that you see the doctor. We can certainly take things like Tylenol and pain relievers to help with the pain. We can take decongestants, but we do need to make sure that we're not taking them for long periods of time, or actually we can make our symptoms worse. Mucolytics to help break down the mucus. We can certainly use any type of antibiotic, especially if there is an infection. It is recommended that you get on some type of antibiotic for about 10 to 14 days and make sure that you use all of them the way that they're prescribed to you. Surgery can also help, and this is really where we're talking about more severe cases, real chronic recurrent conditions. And the idea behind the surgery is to help clean and drain the sinuses, take care of any type of anatomic issues, or remove anything that could be blocking that drainage pathway. There are a lot of newer methods. Some people don't want to do any type of sinus surgery because they feel like it can be very invasive. There could be a lot of downtime, but there are a lot of newer methods that are a lot less invasive than what they used to be. And they use a balloon catheter similar to what they use in like an angioplasty type of treatment, where they insert the balloon, they kind of blow it up so that it helps to create a wider space in the sinuses. So different options that we have now when it comes to surgery with this as well. Dr. Barrett, who is the Associate Academic Dean of the National College of Naturopathic Medicine in Portland, Oregon, says that conventional treatment is the province of ear, nose, and throat specialists. They employ a variety of antihistamines, decongestants, and antibiotics. If the condition persists, the last resort is surgery, cutting away the swollen mucous membrane and attempting to establish artificial drainage pathways. He attributes the prevalence of chronic sinusitis to the fact that Western medicine has been so unsuccessful in its treatment. He recommends a very root cause approach, which is what Cures believes in as well. Excuse me. Speaking of allergic rhinitis, right? I'm definitely suffering from seasonal allergies right now. He recommends a root cause approach through proper diagnosis of allergies, through regulation of diet, using alternative methods. He believes in getting the right amount of rest, following a very simple diet that's void of sugar and possible allergic foods. And he believes that that's where you should always start. And if you start there, you should see a lot of results, very successful results just from that. In acute sinusitis, a great treatment is to think about your diet and nutrition like we just talked about. Something like a water fast would be great. And again, talk to your doctors about this stuff before you do it. But basically what a water fast does is it helps to free the body from using energy to fight the infection instead of digesting food. We know that for the body, its first responsibility is to always digest the food so that we can utilize it the way that we're supposed to. But when we're eating foods that are not easily digested, or if we're having some type of allergic reaction, if we're not combining our foods properly, then it puts a lot of stress on our digestive system, and it uses a lot of energy that can be used to help fight the infection. So, you know, even if you want to do some type of a light diet, where we're emphasizing fruits and vegetables or vegetable broth, any type of clear liquid. We want to try to avoid any sugars because they can slow the immune functions. They can also encourage bacterial growth and activity. We can also increase our vitamin A, C, and E will also help, as well as increasing our zinc. When we're talking about chronic sinusitis, all of these suggestions on this page we're going to do in addition to what we just talked about on the last page with the clear fluids, the lighter diet, things like that. But we can also increase things like selenium. Selenium is something that we'll find in fish and poultry, whole grains, things like that. Bioflavonoids we'll find in citrus fruits, plants, fatty acids that we can find in evening primrose, black currant oil, flaxseed oil, vitamin B. We certainly want to make sure that we're avoiding foods that are causing allergies or sensitivities. We want to certainly make sure that we're getting proper digestion and that we have the elimination of stress. This is crucial to really helping in our treatment. We can also do things where we're applying a warm, moist compress to the area to help open those transition spaces. So you can just take a warm washcloth, place it over the eyes and cheeks, and leave it on until it cools, and you can warm it again and repeat it as it's needed until there's some type of relief. You want to make sure that you're drinking plenty of fluids because the fluids will help to thin the mucus. You want to avoid sugary fluids because the sugar can promote the growth of yeast, and it's linked to sinusitis. So clear fluids that don't have sugar in them. A nasal saline spray several times a day is great because, again, it will help to thin the mucus, and especially in children where we can't use certain medications, this can be particularly effective for them. Some type of nasal irrigation where there's some type of salt water solution. You know, we're seeing a lot more of this when it comes to things like the neti pot, things of that nature. Again, it's really designed to help loosen the mucus, to help reduce the swelling. You're basically using some table salt and some warm water, and you're basically almost like pouring it into the nose. You know, it comes in a couple different ways you can use it. It looks like a little teapot or like a nasal bulb where you're going to kind of tilt your head back, pour this into one side or squirt it into one side of your nose, and it should come out the other side. And if it doesn't, by doing this several times, eventually it will help to clear up the blockage. A humidifier is always great also. You know, if you can sleep with a humidifier, they also make the humidifier kind of like a Vicks humidifier where you can put a there's a little section right where the steam comes out that you can actually pour a liquid Vicks solution into that so that when the steam comes out, that Vicks now goes into the air, and that's what you're breathing in, all of those little oil droplets. So now not only are you getting the humidity back into the air to help thin the mucus, but you're also breathing in all of that camphor and eucalyptus and things like that that will also help with the congestion. Certainly you want to make sure that you're getting plenty of rest, but it's important to remember that when you're laying down, don't lay completely flat. You want to make sure that you keep a pillow under your head to help drain your sinuses. Things like a little massage can also help because it can increase the blood circulation and ease the pain. You can use different things where you're just doing some type of acupressure massage where you're pressing on certain pressure points on your face to help relieve the congestion as well. Cut down on the alcohol because that will cause swelling of the nasal and sinus membranes. Also avoid swimming in chlorinated pools and never dive in because the chlorine can irritate the lining of the nose, and then that diving sometimes will force water into the nasal passages up into the sinuses, so you want to be careful with that. Avoid smoke-filled rooms because the smoke dries out the nasal passages and then the bacteria can get trapped in there. We're not seeing as much of this anymore because most people are not smoking in their houses like they used to years ago, and you know, most of the states now have laws in effect where you can't smoke in restaurants or bars or things like that anymore. So hopefully this is not as much of a concern as it used to be years ago. When we're talking about treatment with diet, things like foods that will help to heat the cavities. What we mean by that is things like horseradish, onions, chilies, cayenne pepper, garlic, mustard, anything that will inevitably make your nose run is what you're looking for, because again, it will help to drain that mucus. So your goal is always to eat enough to kind of make your water run, but obviously if you overdo it, if you're eating things that are just too spicy, drink milk, eat like bread with butter on it to kind of help calm down and coat the mouth to block the burn. Things like ginger are great because that's a natural anti-inflammatory. Fruits and vegetables are great because it helps to boost the immune system and load the body with powerful antioxidants. Red bell peppers, kiwi fruit, anything that's really loaded with vitamin C to, again, keep the immune system functioning at its optimum level. Hot tea, soup, anything like that. Soup typically works better than tea because you're seeing, things like chicken soup is typically what we're eating when we're sick, and you're getting the protein from the chicken. You have the clear broth. Usually you have garlic in there, which is helping the immune system as well. But both of these have that warm steam that we're kind of inhaling as we're eating them as well, which is also going to help warm up the sinuses and help to drain the mucus out. Foods that are rich in vitamin E, things like nuts, greens, sweet potatoes, kale, canola oil, almonds, wheat germs, sunflower seeds, nutritional supplements, vitamin C. We want to look for things that have a lot of antioxidants in there. That's going to help to boost our health, that are going to help to reduce inflammation. Anything that's going to help to really heal the body. Certain foods that we should avoid: dairy, things like milk, cheese, sugar, carbs, they can all be mucus forming. Sugar, we know, can increase the yeast. It also is a natural inflammatory. Anything refined carbohydrates, again, mucus forming. Alcohol, we said earlier, can swell the membranes. Caffeine, alcohol also can cause dehydration. Foods that cause histamine levels to rise: red wine, alcohol, caffeine, MSG. So you want to avoid those as well. You can also do different alternative therapies, things like colon therapy, which helps to release toxins and cleanse the blood. It helps to stimulate the immune system. It aids in restoring the pH balance in the body. That will be very helpful. Craniosacral therapy is also very, very helpful because it helps with any imbalances in the craniosacral area that can occur before birth, or that can occur during a difficult delivery, things like that, where it causes almost like a distortion to those cranial tissues, and that can certainly affect proper drainage. So it's very successful if you have young children that are getting chronic ear infections, sinus infections, that you can have those young children go for craniosacral therapy to get everything lined up properly, and they're very, very responsive to these types of corrections. Chiropractic care is also very successful because, again, it's lining everything up the way that it should be. Acupuncture certainly will help as well. According to Dr. William Cargile, who is the chairman of research of the American Association of Acupuncture, he says that to effectively treat sinusitis, you want to stimulate the body to detoxify so that it will raise its energy. Once this happens, often the sinusitis will be better within minutes, and in some cases the relief will last for weeks, sometimes months, without the need for further treatments. The World Health Organization has cited that sinusitis can be treated by acupuncture. So basically his belief is just that, sinusitis can be linked to the toxins in the bowels and the intestines, just like anything else. When we take the root cause class with cures, we always talk about having a clean colon. Without that clean colon, you're never going to be a truly healthy person. And this all goes back to, again, that Chinese philosophy of medicine, really making sure that our body is healthy, that the qi is flowing through properly, that there are no blockages. If there is, you will see conditions arising along those meridians. And so that's basically this philosophy with the acupuncture, is that when you're working on different pressure points, whether it's acupuncture or acupressure, once you open up those blockages, that chi will flow through those energy zones better, and you won't have these conditions that you once did. We can also use some type of herbal medicine, purple coneflower, ephedra, golden seal, Oregon grape, horseradish, poke root, yarrow, garlic, wild indigo, stinging nettle, eyebright, and elderflowers. These are just some of the herbs that will help to boost our immunity. They'll help to get rid of the bacteria and help to fight the infection. Acupressure certainly is something that will help, and this is what we use in the Cure Sinus Relief Facial. We really focus on different acupressure points to help relieve the congestion, reduce the inflammation. So without getting too much into the whole philosophy behind acupressure, there's different meridians that run through the system. Those are your energy zones. That's where your chi runs through. If there is any type of blockage along that meridian, it will cause some type of condition to emerge on another area of that meridian because your circulation is not moving properly throughout that meridian. So the idea is to open up those passages and allow things to flow through properly. So there's different names to each meridian. The first one here is large intestines 20. That's the 20th point on the large intestines meridian. There's about 300 different acupressure points on the whole body, and there are certain ones that will focus on different conditions. So in this area, large intestines 20 is beneficial for any nasal symptoms. Large intestines 4 relieves pain. It's the command point for the face. Lung 7 relieves nasal obstructions. Bladder 2, stomach 3, liver 3, they all help to relieve sinus blockage and headache, and so on as we go down this page. If you're wondering where all of these points are, there are so many different acupressure maps that you can look up that will show you all of the points. But when we do these classes in person, we'll go through where all of these points are so that it is clearer to you. You can also do something like foot reflexology. And again, this is all goes back to the same philosophies, all of these meridians, things being connected, things being mapped out. So for foot reflexology, it basically works that the pressure points have referral areas to different areas on your body. And basically, as you're going down the foot, when you're starting with the toes, it's basically the referral areas are referring to the tops of your head. So the toes, the big toe is your head, your whole face. Your smaller toes are your sinuses. Underneath your toes are your ears and your eyes. And as you go down, you're basically going down the body. So underneath the toes in that wider area, you have the whole chest area, your lungs, your heart, breast, upper back, things like that. The narrower part of your foot is also the narrower part of your body, the waist area, so all of those organs that are inside of that cavity. Where the foot starts to get wider at the bottom, again, it's where your body starts to get wider, the hip area. So the bottom part of the foot is referring to the intestines, the colon, things like that. So when we're dealing with reflexology, whether it's on the hands, whether it's on the feet, certainly we want to make sure that we're focusing on the sinuses, the eyes, the ear, the face reflexes. So whether it's your hands or your feet, you're going to work your fingers or your toes would be the referral area for all of that. The sinus reflex, with your left hand, you can support the right foot. Use your right thumb to work over the entire surface of all the toes, starting on the inside edge with the big toe. When you reach the little toe, change the support hand and use your left thumb to work back across the big toe. And repeat this on the left foot. As far as the eyes and the ears reflex, you're going to support the right foot with your left hand. Rotate the right thumb gently on the first bends of the second and third toes and repeat this on the left foot. For the face reflex, you can make a fist with the left hand and push it into the sole of the right foot. Use the right index finger and work the areas on front of the first 3 toes. Work across each toe, starting beneath the nail and ending where it joins the foot, and repeat it on the other side. Again, in our classes that we do in person or in salon or customized trainings, we will go through all of this as well. Same idea with the hand reflexology. Again, you're going to work those sinus referral areas, so anything with the fingers. For the sinus reflex, you're going to work the right hand first using the left thumb to work the reflex points up the length of the thumb and all the fingers starting at the base. The eyes reflex, you can use your left thumb to make small clockwise rotating movements over the reflex on the first bend of the right index finger and repeat that on the left hand. The ear reflex, you can use the same technique on the reflex point on the first joint of the middle finger and repeat that on the left hand. And for the face reflex, use your left thumb, work it across the right thumb starting below the nail. Work the same area on the index and middle fingers, and again, repeat that on the left hand. We can also use aromatherapy, and again, this is something that we will use in our sinus relief facial, and this is designed to help break up the congestion, help to expel the mucus. There are also some aromatherapy blends that are antiseptic that will help to fight infection and stimulate the immune system. They work to open up those nasal passages, reduce the swelling of the nasal tissues, clear up congestion, and reduce pain. Most common when you're dealing with sinus issues and congestion is eucalyptus, camphor, cedarwood, marjoram, peppermint, wintergreen, rosemary, tea tree, thyme, pine, ginger, cinnamon, and lavender. Also things like the Vicks Vapor Rub, because it contains camphor, which is found in eucalyptus and rosemary. So that's why the Vicks works. When we're talking about things like eucalyptus is something that's originated in Australia. It clears the sinuses. It helps to soothe the mucous membranes and relieve bronchial congestion. Camphor is from the evergreen tree. It's an oil that's extracted from the wood and the leaves of that tree. And it's very antiseptic, very analgesic, helps with inflammatory issues. It relieves pain, it stimulates circulation, it clears congestion, it eases your breathing, and it helps to speed your recovery. Peppermint is also an anti-inflammatory. It helps to soothe the mucous membranes. It does also act as an expectorant as well. Lavender is also another one. It's one of the best and fastest remedies for a sinus headache. You can just put a little bit of lavender oil above each eyebrow and on each cheekbone, and within 10 minutes you'll get a lot of nice relief. So it's also something that's good to immediately stop the sinus drainage, especially when your head hits the pillow so you can sleep. And you can do different inhalations with this as well. The treatment when the sinus condition is related to allergies. Obviously, you want to make sure that you avoid the allergy triggers. You can take antihistamines, a nasal steroid spray, or you can do some type of allergy shots to help build up your immunity to those allergens. Most sinus infections can be treated with a combination of self-care measures, controlling allergies, and medical treatment. If self-care measures don't prevent your sinus problems, further testing or a referral to an ENT specialist may be in order. So what can cures do? We have our sinus relief facial. Your target market for this facial is clients that have facial swelling, puffy eyes, dark circles under the eyes, sinus pain or pressure, and nasal congestion. The wellness effects that you can expect from this facial are that not only does it deeply cleanse the skin, because we are doing a facial, but it will also help to clear up the sinus cavity and the respiratory system. It will help to release fluid that's trapped in the skin tissues and help to reduce any puffiness that you're experiencing. In this facial, we do utilize aromatherapy. We use camphor, peppermint, eucalyptus, and we also have a whole pressure point massage that we do in place of the extractions. This facial is focused on cleansing the skin and reducing inflammation, reducing congestion. So we're not really focused on extractions here. So we take the extraction part of the facial out, and in place of that, we do the aromatherapy and the pressure point massage. Now, when we do classes in person, we'll go over all of this. But just so that you know, in your Cures therapy guides, the protocol is written out very, very clearly, and there's pictures and diagrams of exactly where all of these points are. But some of the products that we'll use within this facial, the eye makeup remover is a great product to use. First of all, because obviously it's going to help to remove any makeup that we have on our eyes. But secondly, because it is so gentle and so soothing and so conditioning, it really helps to calm down the eye area. So even if you're suffering from seasonal allergies and you get real itchy, red, irritated eyes, if you put some of this on a cotton round, especially if you put it like in a refrigerator and you get it nice and cold and then put it on the eye area, it will help to reduce the swelling, and it will also help to really calm and condition that eye area. It's exceptional to use for those real dry, itchy, irritated eyes. Gentle cleansing milk, you can use either cleanser for this facial. You can use the gentle cleansing milk or the foaming cleansing gel. I tend to use the gentle cleansing milk because I just feel like people are so tender on their face, so anything that I can do or use that's very soothing and very gentle, that's what I want to use. And so gentle cleansing milk just fits that mold for me. We have the seaweed, the sweet almond oil. We have the lavender and the calendula, so very calming, very soothing. Again, that lavender will also help with any type of headache that somebody might be experiencing. And there's such nice slip to this, so it's just a nice gentle glide that you get across the skin and very soothing to the client. And of course, it's going to clean the skin. We have Sinus toner. Again, we are cleansing the skin here. So the Sinus toner has the algae extract as well as the fucus fasciculosis, lactic acid, and ylang-ylang. Very mineral rich, very hydrating. Most people that have any type of allergies, they tend to get really dehydrated in their skin. So this will add a lot of hydration and balance the skin's pH, as well as helping to remove any dirt or oil or makeup. Algae Deep Pore Cleanser is great because we talked earlier about if there's a lot of congestion or impurities underneath the skin, you might see impurities emerging on the outside of the skin as well in those same areas. So something like Algae Deep Pore Cleanser will help to really do a nice deep cleanse in the skin. It will help to release any of those impurities. And again, because of how gentle this is, there's nothing abrasive about this. It's a great exfoliant to use on the client without being something that's too intense for them. So with this product, I would use it just a dime-size amount on my fingertips, mix it with a little bit of water, and you'll get a nice foaming action, and just work it into the skin for about 2 minutes to help release those impurities, do a nice exfoliation, and then remove it with a nice warm towel or cotton. Skin Repair Sea-Mist is Skin Repair Serum is something that we can use either directly on the face, or we can use this on the décolleté area. Anytime that we're doing a décolleté massage, we'll always use this on that area to help put all of those really good nutrients back into the skin. We're using basil, marjoram, lavender, so really great for helping to increase the lymphatic flow, real hydrating ingredients in here as well. And then we're going to follow it with the activator. The activator is something that just has seawater and phytoplankton in it, so loaded with vitamins and minerals and trace elements. We can use this by itself, but when we use this with the serum, it helps to drive the serum much, much deeper into the skin, making it much more effective. When we're dealing with people with sinuses, again, if they're suffering from a lot of dehydration in their skin, this is a great product to put a couple layers on, or they can use this at home by themselves and just spray it on their face to add that hydration back into their skin as well. Pore Balancing Moisturizer, great for congested skin, combination skin. This will add a lot of hydration back to the skin as well without being a real heavy cream. But we have shea butter, grapefruit seed extract, citrus acid, fucus fasciculosis, really helpful in helping to restore the skin's pH, provide antibacterial protection, and helps to release impurities that are trapped under the skin. Purifying Blemish Moisturizer, great for oily skin, blemished skin, enlarged pores. In here we have the Alp sebum, which helps to reduce the pore size as well as sebum production. The willow bark extract helps to fight inflammation and decongest clogged pores because there's some salicylic acid in there. We also have lactic acid, glycolic acid, and salicylic acid as well. All of this will help to increase your cell turnover and reduce blackheads, blemishes, decongest your pores, and help to improve the skin's texture. Revitalize is a perfect eye cream to use in this facial because it's dealing with the puffiness around the eye area. We have haloxyl, which helps to reduce dark under eye circles and also strengthen the capillaries around the eye area. Soy proteins, dimethicone, ceramide 2, really nice job in helping to rehydrate the skin, plump the surface around the eye areas while reducing the puffiness and the dark circles. Energizing remedy is what we're going to use when we get into the aromatherapy portion of this facial because it has such a great blend of ingredients in here that really help to open up those nasal passages. We have peppermint, sage, rosemary, eucalyptus. The way that you'll use this in your facial is you can take a couple of drops on your hand and just cup it a couple inches away from your client's nose or mouth and tell them to take some really deep breaths in. You want them to really breathe in very deeply through their nose. You really want to make sure that all of those droplets of oil that are being released into the air, they're now breathing in through their nose to really get the benefit of them, and then really release all of that through their mouth. So we're going to allow them to take these deep breaths in for about 2 minutes or so, really get the benefits of this aromatherapy. You can then wipe whatever oil is left on your hands across their décolleté so that they still get those benefits. And now we're applying it topically as well. While we're masking our client, we will also take a piece of cotton and put a couple drops of the energizing remedy on it and place it under their nose so that while they're masking, they're breathing this in again. When we're done with this breathing inhalation, we'll get into the sinus congestion phase. And these are some of the acupressure points that you'll be working. So you're going to work around the ocular orbit or the eye orbit. The average eye has about 5 pressure point indentures along the eyebrow. Now, it all depends on how you're trained. It all depends on the client. Acupressure points are not an exact science. They can vary from person to person. They call it a soon, which is basically the width of your thumb. So it can basically vary where that pressure point is about that width. So long as you're getting the general area, you will be totally fine. But some people will do the pressure points around the eye, either right on the eyebrow, right under the eyebrow, or right over the eyebrow. It all depends on kind of how you're trained and where you feel comfortable working. But you'll hold each point for about 10 seconds or so and move to the next point. And you'll end at the last point, which is right on the temple area. Next, you'll work down the nose, and now we're focusing on the ethmoid sinuses here, right, at the bridge of the nose. So you can push on these 2 points where the stars are on the side of the nose, slide down to the indenture between the nasal and ocular bone. You can actually feel a little indent right there where those bones meet, and you can apply pressure there, and then work under the eye on the ocular bone underneath the eye area. There's 3 points there. Next, you're going to go down to the bottom of the nose and use your forefinger and middle finger at the sides of the nasal sinuses and work across the zygomatic bone. When you're doing this, you're kind of almost doing like a lifting technique with those pressure points. And again, all of these areas might be tender on your client, so make sure that you have good communication with them. Remember that if there is some type of infection in those sinuses, here particularly we're talking about the maxillary sinuses, if that's tender, you might want to go a little bit lighter with your touch, or maybe you start lighter and gradually go a little bit deeper as they can handle it. So make sure that you're talking with your clients about their comfort level. And you're going to work from the side of the nose across the zygomatic bone right out to the ear. So now you're going to move to the lower earlobe, massage the lower and upper earlobe, and work these 4 points that are marked with the X up the earlobe. Then you will sweep from the maxilla down to the mandible from the upper jaw down to the lower jaw, again aiding in the assist of the drainage. And then continue that drainage down towards the lymph nodes on the sides of the neck. And you can sweep all this out right through the décolleté. Okay? So we've gone through a lot of different information throughout this class as far as definitions, causes, symptoms, a lot of different treatment options for you to think about, whether it's at home, in the spa, alternative treatments. There's a lot of different things that if we are not able to do it, we can at least educate our clients on some of these alternative options where they don't always have to be looking for the medication over the counter. We know that more and more we're becoming aware of all of these side effects that are occurring with medications, and if we can offer our clients or our family or ourselves different options that don't have those side effects, of course that's what we're going to lean towards. So we've given you some nice information. If there's things that you want to learn more about, feel free to call me, to email me. Obviously, you can do some research on your own as well. I hope maybe I sparked an interest in one of these topics for you. If you have any questions, my information is on the screen. I look forward to hearing from you, and I look forward to having you on future webinars. Thanks for joining us, and have a great day.